Artificial intelligence, AI, is revolutionizing healthcare. From improving diagnostics to streamlining operations, AI offers unprecedented opportunities to enhance patient care. But with these advancements come significant ethical challenges. Can we trust a machine to make life or death decisions? What happens when algorithms introduce bias or compromise patient data? Today, we'll explore the pressing ethical concerns surrounding AI in healthcare. We'll discuss issues like bias, privacy, accountability, and equity, factors that demand attention as we integrate AI into the healthcare system. The promise and risks of AI in healthcare. AI has already demonstrated its potential in healthcare. It helps identify diseases like cancer earlier than traditional methods, supports doctors in formulating personalized treatment plans, and even manages hospital logistics to improve patient care. But this promise comes with risks. In healthcare, even a small mistake can have dire consequences. For example, if an AI misdiagnoses a condition or suggests an incorrect treatment, the result could be catastrophic. The challenge isn't just about developing effective AI tools. It's about ensuring that these tools are ethical, trustworthy, and reliable under all circumstances. Bias in AI systems. One of the most concerning ethical issues is bias in AI. These systems learn from existing data, and if that data reflects societal or systemic biases, the AI can perpetuate or even amplify them. For instance, many AI models used in healthcare are trained on data from predominantly white, male populations. As a result, the algorithms may not perform as well for women or people of color. A notable example occurred in 2019 when researchers discovered that a widely used AI system underestimated the health needs of Black patients. This bias isn't merely a technical problem, it's an ethical one. In healthcare, bias can lead to misdiagnosis, delayed treatments, and unequal access to care, further entrenching existing disparities. The solution lies in training AI systems on diverse and representative datasets while rigorously testing them for fairness. Privacy and data security. AI thrives on data. In healthcare, this means access to sensitive patient information like medical histories, genetic profiles, and personal identifiers. But with great data comes great responsibility, and breaches of privacy are a significant ethical concern. The healthcare sector is already a prime target for cyberattacks. In 2023, millions of patient records were compromised due to security breaches in hospitals and clinics. Introducing AI into this equation increases the complexity of safeguarding this data. Another ethical issue revolves around consent. Do patients fully understand how their data will be used by AI systems? Even if they consent, can healthcare providers guarantee their data's safety? Ensuring robust encryption, access controls, and transparency in data usage is crucial for maintaining trust. Accountability for AI decisions. When AI is involved in healthcare decisions, accountability becomes a gray area. Unlike human doctors, AI systems can't be held morally or legally responsible. Imagine a scenario where an AI system misdiagnoses a patient, leading to inappropriate treatment. Who is at fault? Is it the developers who created the algorithm, the healthcare provider who implemented it, or the institution that adopted the technology? The lack of clear accountability complicates the adoption of AI in healthcare. Regulatory frameworks must address this issue by defining who bears responsibility when AI errors occur. Without accountability, trust in these systems will remain elusive. The human touch in healthcare. AI can automate many aspects of healthcare, from administrative tasks to certain diagnostic processes. While this can enhance efficiency, it raises concerns about the erosion of human interaction in patient care. Healthcare is more than just treatments and diagnoses. It's about compassion, empathy, and trust. Machines, no matter how advanced, lack the emotional intelligence to provide the human touch that patients often need. For example, an AI might accurately diagnose a condition, but it cannot offer the reassurance or emotional support a doctor can. Striking a balance between automation and human involvement is critical. Patients must feel cared for, not treated as mere data points in an algorithm. Equity and access. AI has the potential to improve healthcare accessibility, especially in underserved areas. For instance, AI-powered diagnostic tools could bring advanced healthcare to rural regions lacking specialist doctors. However, the reality is often less optimistic. Developing and deploying AI systems requires significant resources, and these are typically concentrated in wealthier regions. This creates a digital divide, where only privileged populations benefit from AI's advancements. The ethical challenge is ensuring that AI in healthcare is equitable. Governments, organizations, and developers must work together to make these technologies accessible to all, regardless of socioeconomic status or geographic location. Transparency and explainability. Another pressing concern is the lack of transparency in how AI systems make decisions. Many AI algorithms function as black boxes, producing results without providing clear explanations of how those results were reached. In healthcare, this lack of explainability can be problematic. Patients and doctors need to understand why an AI recommends a particular diagnosis or treatment plan. Without this transparency, trust in AI systems diminishes. Developers must prioritize creating AI systems that are not only accurate but also interpretable. Transparent systems allow healthcare providers to better evaluate and trust the recommendations made by AI. The role of regulation. The ethical challenges of AI in healthcare are compounded by the lack of comprehensive regulation. While some countries have begun drafting guidelines, there is no global standard for governing AI in healthcare. Regulatory frameworks must address key issues like data privacy, bias, accountability, and transparency. These regulations should also include mechanisms for continuous monitoring and evaluation of AI systems to ensure they meet ethical standards. Without robust regulation, the integration of AI into healthcare risks becoming a patchwork of inconsistent practices, further complicating ethical concerns. Building ethical AI for healthcare. Addressing these ethical concerns requires a multifaceted approach. Here are a few strategies. 1. Diverse data training. Developers must use diverse and representative datasets to train AI systems, ensuring fairer outcomes for all populations. 2. Stringent privacy protections. Healthcare organizations should implement robust data security measures, including encryption and regular audits, to safeguard patient information. 3. Collaborative development. AI systems should be designed with input from ethicists, healthcare professionals, and patients to align with ethical principles and real-world needs. 4. Explainability. AI systems must provide clear, understandable explanations for their decisions, allowing healthcare providers to evaluate their recommendations effectively. 5. Regulation and oversight. Governments and international bodies should establish comprehensive regulatory frameworks to address ethical challenges and build public trust in AI. AI is reshaping healthcare in ways we could only imagine a few decades ago. But with great power comes great responsibility. The ethical concerns we've discussed, bias, privacy, accountability, equity, and transparency, are not just theoretical issues. They have real-world implications that affect patient outcomes and the future of healthcare. For AI to truly revolutionize healthcare, it must be ethical, trustworthy, and inclusive. Achieving this requires collaboration across all levels: developers, healthcare providers, regulators, and society at large. The future of AI in healthcare isn't just about technological advancements. It's about how we choose to address these ethical challenges today. By doing so, we can ensure that AI becomes a force for good, improving healthcare for everyone, not just a select few. What are your thoughts on the ethical challenges of AI in healthcare? Do they make you optimistic or cautious about the future? Let us know in the comments below. Don't forget to like, share, and subscribe for more in-depth discussions on the intersection of technology and ethics.